10 Signs and Symptoms of Stroke, Recognizing a Medical Emergency. Welcome to Vital Signs. In this episode, we're delving into the urgent topic of recognizing the signs and symptoms of a stroke, a critical medical emergency. Join us as we explore the 10 key indicators, from facial drooping to speech difficulty, and learn why acting fast, facial drooping, arm weakness, speech difficulty, time to call emergency services is essential for saving lives. Hit subscribe for more crucial health insights, and together, let's empower ourselves to respond effectively in emergencies. Stay informed, stay prepared, and let's make a difference with vital signs. The human brain is the control center of everything we do, from thinking and feeling to moving and speaking. A stroke occurs when blood flow to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. Brain cells begin to die within minutes, and the longer blood flow is blocked, the greater the potential for lasting damage. Recognizing the signs and symptoms of stroke quickly and acting fast, facial drooping, arm weakness, speech difficulty, time to call emergency services, is critical for minimizing brain damage and improving recovery outcomes. The brain and how stroke affects it. The brain is divided into different regions, each with specific functions. The cerebrum, the largest part, controls movement, sensation, thinking, and emotions. The cerebellum coordinates balance and movement, while the brainstem regulates basic life functions like breathing and heart rate. When a stroke occurs, symptoms depend on the affected brain area. For instance, a stroke in the region controlling speech might cause slurred words, while one affecting the motor cortex could lead to weakness in an arm or leg. The 5 classic signs of stroke fast. These 5 signs are the most common indicators of stroke and form the basis of the FAST acronym, a memory aid for quick recognition. 1. Facial drooping. One side of the face may droop or feel numb. Ask the person to smile and observe if one side appears uneven. 2. Arm weakness. The person may have difficulty raising one arm or experience weakness in one arm compared to the other. Ask them to raise both arms and see if one drifts downward. 3. Speech difficulty. Speech might be slurred, garbled, or difficult to understand. The person may struggle to find words or speak in complete sentences. Ask them to repeat a simple phrase like "My name is," and listen for abnormalities. 4. Time to call emergency services. Every minute counts in a stroke. If you notice any of these signs, call emergency services immediately, for example, 911 in the US and Canada. Don't wait for symptoms to worsen or disappear entirely. Additional considerations for FAST. 1. Difficulty seeing in one or both eyes. Sudden vision changes, blurred vision, or complete vision loss in one eye can be a stroke symptom. 2. Sudden severe headache. A particularly severe headache, especially if accompanied by other stroke symptoms and with no known cause, can indicate a stroke. 5 less common but important stroke symptoms. While the FAST acronym covers the most prevalent signs, other symptoms can also indicate a stroke. 1. Dizziness, sudden balance problems, or loss of coordination. Stroke can affect brain regions responsible for balance and coordination, leading to dizziness, stumbling, or difficulty walking. 2. Confusion, disorientation, or sudden changes in mental state. Confusion, disorientation, or unusual behavior can be signs of stroke, especially in older adults. However, it's important to differentiate between confusion and normal forgetfulness. 3. Numbness or tingling sensation on one side of the body. Numbness or tingling on one side of the face, arm, or leg can be a stroke symptom. This is different from tingling caused by conditions like carpal tunnel syndrome, which typically affects specific areas and may not be one-sided. 4. Difficulty swallowing. Stroke can affect the muscles involved in swallowing, making it difficult or impossible to swallow food or drink safely. 5. Seizures. In some cases, stroke can disrupt electrical activity in the brain, leading to a seizure. Variations in stroke symptoms. 1. Differences between men and women. While stroke symptoms are generally similar for both genders, some variations exist. Women may experience more weakness on one side of the body, fainting, and difficulty breathing compared to men. Additionally, women are more likely to report feeling lightheaded or having a sudden severe headache. 2. Recognizing stroke in younger adults. Stroke is often perceived as a condition affecting older individuals, but it can occur at any age, including young adults. Be aware of the signs and symptoms and seek medical attention immediately regardless of age. 3. Importance of seeking attention for mild or transient symptoms. A transient ischemic attack, TIA, also known as a mini-stroke, is a temporary blockage of blood flow to the brain that usually resolves within minutes or hours. While symptoms of a TIA might be mild and disappear quickly, it's a significant warning sign that a full-blown stroke could occur. Never ignore TIA symptoms and seek medical attention promptly. Early evaluation can help identify risk factors and prevent future strokes. What to do if you suspect a stroke? If you suspect a stroke in yourself or someone else, here's what to do. Call emergency services immediately. Don't wait for symptoms to worsen or disappear. Every minute counts when it comes to stroke treatment. The sooner blood flow is restored, the greater the chance of minimizing brain damage and a full recovery. While waiting for help, gather information about the person's medical history, including any pre-existing conditions and medications they take. Note the time symptoms began. This information is crucial for doctors to determine the best course of treatment. Stay calm and reassure the person. Speak in a calm and gentle voice and avoid making any sudden movements that might startle them. Do not give the person food or drink. Difficulty swallowing is a potential stroke symptom, and choking could be a risk. Attempt to move the person unless they are in immediate danger. Delay calling emergency services in hopes that symptoms will improve on their own. Stroke is a medical emergency, but with prompt recognition and treatment, the chances of a full recovery are significantly higher. Remember fast, facial drooping, arm weakness, speech difficulty, time to call emergency services as a reminder of the key stroke signs. Additionally, be aware of the less common symptoms and variations in presentation. Early intervention is critical, so don't hesitate to call emergency services if you suspect a stroke. Thank you for tuning in to Vital Signs today. We hope this information equips you with the knowledge to recognize and respond to a stroke swiftly. Remember, early action can save lives. Don't forget to subscribe for more insightful videos on health awareness and emergency preparedness. Hit the notification bell so you never miss an update. Let's continue to stay informed and make a positive impact on our well-being. Until next time, stay vigilant, stay safe, and take care of your vital signs. See you in the next episode.